Hey everyone, this is the SIBO Project. Let's talk about Autism Spectrum Disorder or ASD. Now let's all learn what is ASD. The Diagnostic and Statistical Manual of Mental Disorders 5th edition by the American Psychiatric Association classified ASD as a neurodevelopmental disorder that affects the normal function and development of the brain. As a developmental disorder, ASD symptoms and diagnosis typically appear in early years of life and can be a lifelong disorder. Persons with autism spectrum disorder commonly experience difficulties that are also called deficits in social interaction and communication, expressing thoughts, wants, and needs through verbal and nonverbal communication, as well as initiating and exchanging simple conversation with another person is kind of not easy and unusual for individuals with ASD. In addition, deficits in developing, understanding, and maintaining relationships are also observed. One of the diagnoses of ASD also looks at the presence of restricted interest and repetitive behaviors. This kind of behaviors can be observed as repetitive motor movements, use of objects, or speech. And these are also the reasons why ASD affects a person's learning and skills development. But despite that, and ASD being a lifelong disorder, effective treatments and services are available that will help in improving a person's functioning in all areas of life. A systematic review update was done in March 2022 to identify the approximate number of persons with ASD worldwide. Estimated number was about 1 out of 100 children has autism. Symptoms and diagnosis typically appear during the second year of life, but with severe developmental delays, observed symptoms can be earlier than 12 months. Otherwise, it can be later than 24 months if the developmental delays are more subtle. There might be similar symptoms that build up an ASD diagnosis. Symptoms and severity also vary between persons with ASD in different ways. That is why it's called spectrum. These are some common noticeable signs. Keep in mind that not all these signs are present in all persons with ASD. The symptoms and severities still vary between each person with ASD. If some of these early signs are observed, consult a doctor or professional for further assessment and diagnosis. By doing the first step to a successful intervention, we'll benefit by having the proper awareness, as well as the right knowledge, and the best support we need and the persons we love. Remember, what we learned is what we know. And most importantly, love all the learning opportunities. This is the SIBO Project. Follow us and learn more.